the tradition of the mental health field, it's settled culturally, probably not entirely singular due to one design, and implement an area of focus or attempting to help in a way and settle in certain ways. But a psychiatrist, you know, psych IA trist versus psychologist, psychologist. A psychiatrist is someone who's more familiar with the biology, physiology. So we go to med school, we rotate in all the different zones and areas of medicine. We have been in the surgical room. We have pe- people under with anesthesiology. We have delivered babies. We have checked out the kidneys. We've done scopes into the bladder. We've looked at cancer. We've done this. We've done roto-rooters for prostate. We've had to do prostate exams. We've had to do IVs on ourselves. We've ventured into the brain. We've done anatomy. We've faced a little bit of death. We've been able to get our hands bloody, uh, texturally, intellectually, into the biology, also into the physics, organic chemistry, physics one, sometimes physics two. That is the area of potential and availability of your vast majority of psychiatrists. Psychologists are, in my uh, still semi limited awareness, they are the research data driven scientists, the PhD doctors versus MD doctors are psychiatrists. Psychologists are ones who have used the power of statistics, mathematics to capture phenomenon. They are extremely useful, wise, and they can do really interesting things, wielding the tool of science. Like the cartographer with the first mate with the captain on the ship. They have their very useful, helpful role wielding those tools and instrumentations. They'll also get some training in some areas of therapy. Now, therapy is not a catch-all term, including the mind is not just one thing. It's like saying the jungle is just one thing or the ocean is just one thing. No, it's a multitude of stacked phenomena and canopies of interacting things all at once. Why we can't solve it and why it's such an awesome pursuit, or in my opinion, you have to leave intellect behind to actually start to grasp it. Um, Anyways, some psychologists will choose certain orientations of therapy. I like to say there's over 50 main types of therapy or styles, orientations, ways to navigate the jungle, over 500 subtypes of therapy. It's impossible to get acclimated and knowledgeable or stylistically talented in all of them. So, all of these providers, psychiatrists including, though a lot of psychiatrists will focus just on biological med management. I think it's better to have hardware and software, in my respectful opinion. Some others like to, ping it out, but a mistake claim that it's better to have a broadening of your radio station awareness with your patients, which I've really sought to do. Um, Psychiatrists, a little bit of therapy, most of meta management. Psychologists, testing using the scientific instruments, doing maybe a little bit more different types of orientations therapists. And then you have the therapists. These are the LCSWs, licensed clinical social workers, or licensed family therapists, counselors, diverse pathways in which you could find yourself into that avenue of helping, which I think they need to keep open and available for people to venture into and evolve into. The therapist finds themselves there, becomes a therapist. There's usually a roundabout life route that they find themselves there. Um, Not for everybody, but then the legion of helpful therapists all have their styles, their talents, their orientations, their ways of navigating the jungle, the type of terrain, the type of mind, the type of phenomenon. And then me as a psychiatrist, I typically, my way of navigating to help you navigate the field is I do the full wraparound in-depth evaluation, which depends on the person. That's anywhere typically 3 to 5 sessions, sometimes 12, sometimes more, depending on the person. Um, And then once I have that solid, good cartography of your jungle, of the dynamics, of the movements, hardware and software, I coordinate and I bring in other team members. I refer you to the right orientation of provider. Bring in a neuropsychiatrist, psychologist to do the testing, to add to the evaluation, to guide the other ways your ocean is interacting with the world with you know, strength and areas of struggle. So it's a little bit of the blend of the type of providers, MD psychiatrists, PhD psychologists, and then the therapists who can have diversity of different professional titles like LCSW, licensed clinical social worker.